Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, and joining us is the Minister of Health, Tyler Shandro. Minister Shandro will lead us with a brief update.
Thank you, Tom. Good afternoon, and thanks for joining me. I'm here today to announce another step forward in our government's response to the COVID-19 pandemic, and the latest example of how this province is leading Canada and the world. Alberta is the first province in Canada to invest in serological testing, to expand our testing capacity and help us track the spread of the virus. Since day one, we've been doing everything in our power to flatten the curve and to limit the spread. And we've succeeded with the help of every Albertan and all of the dedicated people in our health system. We're now well into stage 2 of relaunching our economy and relaunching our health system. But as Dr. Hinshaw has said, the COVID virus is still with us. No region, no community, or group is immune. So we're taking a safe and measured approach. And part of that approach is distributing non-medical masks through drive-through restaurants and other partners, including municipalities, First Nations, Métis settlements, seniors organizations, and places of worship. The first 20 million masks have now been given out, or they're on their way to people who've requested them. Yesterday, we announced that we're getting ready to distribute another 20 million masks starting in July. These masks are an important tool to help slow the spread of COVID-19 throughout Alberta. Testing is even more important, and it's a cornerstone of our relaunch strategy. Alberta continues to be a world leader in testing. In fact, we've now completed more than 400,000 tests, including over 6,500 yesterday. And we're going to keep on leading Canada and the world. And that's why I'm pleased to announce today that our government is investing $10 million into targeted serology testing to help track the spread of COVID-19. Now, serology testing is different from the swab testing that is already available to every Albertan. A swab test, or also known as a PCR test, is done to see if someone currently has the virus. And these tests are essential to identify new cases so that we can trace contact, limit spread, and contain outbreaks. Because it's important to be clear, we will continue to see cases and outbreaks throughout the province. But even with the best testing system in Canada, we know that there are people who've been infected and were never tested. Many of them simply because they never got sick. And that's where serology testing comes in. It detects the presence of antibodies in a person's blood, which can show us if they've been exposed to COVID-19 in the past. And that shows us more about how the virus is spreading and how best to contain it. Serology testing is a big step forward, but we also need to be clear about what it doesn't do. It does not, and I repeat not, replace swab testing. It doesn't tell us if you're currently sick or if you're contagious. And it doesn't tell us if you're immune to COVID-19 or to what degree or for how long. This virus is new, and we just don't know how it behaves yet. We can make assumptions based on other viruses, and they may turn out to be right, but we can't base our relaunch on assumptions. We need to know how much immunity people have after they've been infected, if they can be infected again, etc. Serology testing will help us find out and contribute to the global evidence, which will help all jurisdictions moving forward. We're funding 4 voluntary public health studies, which will allow researchers to closely monitor and also test a representative sample of Albertans. 2 of these studies are going to test groups of Calgary and Edmonton children for antibodies of the virus. These studies will start next month and test the children twice a year until 2022. A 3rd study will regularly test a group of Albertans over the age of 45. And finally, our labs will conduct a study which will anonymously test random samples from blood collected for other purposes across the province. These anonymous samples are going to come from every region and include anyone over the age of 18. Together, these 4 studies will give us a lot more of information about how the virus is spreading. Now, I'm proud that Alberta is the first province in Canada to take this step. It's another example of the leadership that we've shown from the beginning of the pandemic. It underlines our commitment to following the evidence, to contain the pandemic effectively, but also limit the damage to our economy and people's health and quality of life by reopening as fast as we can, but as safely as we can do it. So thank you very much for joining me today. I'd now like to ask Dr. Hinshaw to give today's COVID-19 update. Dr. Hinshaw.
Thank you, Minister, and good afternoon. I'm pleased to report that today, 7,096 Albertans have now recovered from COVID-19. We conducted over 6,500 new tests yesterday and identified 45 additional cases in the province. Currently, 37 people are hospitalized with COVID-19, with 6 of these in ICU. I am happy to report that there are no new deaths to report in Alberta. I want to inform the public that recently our lab identified a group of 800 samples that were collected last week but delayed in getting tested due to a transportation issue. There were 6 positive tests in this group, and the individuals who tested positive have been contacted, and contact tracing is underway. Out of an abundance of caution, a small number of those who tested negative may need to be retested if they were symptomatic. The likelihood of an inaccurate result is extremely low, but the lab will be contacting those individuals who tested negative to let them know that there was a delay in testing their sample and discuss whether or not they need another test. Today, I also want to let you know we are listing an outbreak at the Misericordia Hospital in Edmonton. This outbreak is confined to a single unit, and so far 6 patients and 2 staff have tested positive. Outbreak protocols have already been implemented, and all staff or patients who may have been exposed are being tested. We currently have 532 active cases in Alberta, with 236 of them in the Edmonton zone. I know that many are following these numbers closely. We also continue to monitor the situation closely, including adding the northeast region of Edmonton to Alberta's watch list yesterday. It's important to remember that this list is simply an indicator that health officials need to take a closer look at what is going on. We were in contact with Alberta Health Services and the City of Edmonton, and at this time, there are no additional measures that are needed. As many of you know, a number of restaurants closed in Edmonton over this past weekend, and I've had multiple people ask if Alberta Health or AHS ordered those businesses to close. We did not require closures, and to date there are no known outbreaks at these locations. As part of the guidance we have provided, all restaurants are expected to have procedures in place for rapid response if a staff member or patron develops symptoms of COVID-19. These closures were operational decisions made by the owners of these restaurants. I know that restaurants, cafes, and pubs play a significant role in our society, and that this news was concerning for some Albertans. It is an important reminder that the virus is still here. As we move forward, we will continue to see some new cases in all sectors, including the food service industry, and ongoing use of preventive measures is needed to keep this spread low. It's important to take every case seriously, but also to remember one case does not automatically require a business to close for public health reasons. It also does not mean that anyone who visited the same establishment is automatically at risk. Determining who is at risk is something that our contact tracing teams closely assess based on when the individual became symptomatic and 2 days prior to that point. Anyone at risk of exposure is immediately contacted, offered testing, and required to isolate. When needed, AHS will work with employers and confirmed cases to determine the source of exposure and provide advice on infection prevention and control measures, such as enhanced cleaning that might be needed. Ordering a business to close is only a last resort. Taking this step would be at the discretion of AHS or the local public health inspector if it was needed. I want us all to remember that it's okay for businesses to close temporarily for operational reasons, to clean their establishment, or enhance protections. This is not a sign they are tainted or dangerous. It's the opposite. It's a sign that they care about their patrons and they're taking the health of their customers and their employees seriously. We need to foster an environment where people are supported to do the right thing, addressing cases as they come and reaching out for guidance. At the same time, the closure of these restaurants serves as an important reminder that we have developed detailed public health guidance for a reason. The sun may be out, but you can still catch COVID-19 in any restaurant, business, park, or building in Alberta if precautions are not followed. There are no completely risk-free options. I do not say that to alarm anyone, but rather to stress once again that we all need to follow the guidance to the best of our ability. For businesses, this means respecting and following the guidance that we have put out. For customers, this means showing compassion and kindness to staff if our outing looks a little different than it used to, or if things are taking a little longer because of measures to keep us safe. I was thinking today how there was snow on the ground on March 5th, that long ago day when we identified Alberta's first case of COVID-19. Now summer is officially here. I know, especially after weeks of staying in, that many people are excited to get out and enjoy the too few warm and sunny days. My family and I are too. We've come a long way in keeping our case numbers and hospitalization rates low. Let's all continue to protect one another by acting responsibly and doing our best to follow the guidance every single day. We are each other's best protection against COVID-19, now and in the days ahead. Thank you, and I'd be happy to take questions.
All right, we'll go to the phone. Operator, could you put through the first caller, please?
First is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. You mentioned how Northeast Edmonton is now under a watch classification. What is happening there? And if it does move into the enhanced category, or if any community moves into the enhanced category, what specific measures could be brought back in? What type of restrictions could potentially be reintroduced? So, for example, could certain types of businesses have to close again? Could restaurants move back to doing takeout only, et cetera?
So in Northeast Edmonton, it's important to remember that 50 cases per 100,000 metric is hit at different levels depending on the population in that area. So there are 45 cases in Northeast Edmonton, the vast majority of which are linked to known outbreaks or close contacts of a known case. So at this time, there's no evidence that there's widespread transmission in that community from unknown sources, and it does not seem like there's any additional measures that need to be put into place. With respect to the potential additional measures that might be needed, that would be something that would be discussed with local municipal officials depending on where that particular area is, as well as with Alberta Health Services and their local public health teams. And any kind of measures that would be considered would be based on that local epidemiology, based on where we see transmission happening, and whether or not additional measures are needed to control the spread. What we've seen in the 3 municipal areas where we have had a watch level to date in Alberta is that the majority of the cases, if not all of them, are transmission from known sources, where the important work of contact tracing and testing has revealed a number of cases where that can be isolated, where their close contacts can be self-isolated to prevent spread, and there's no additional measures that have been necessary. And so again, that's something that continues to be the case, and additional measures would only be put in place if they were needed based on the specifics of a situation in terms of where the spread was happening in that particular location.
Operator, can you put through the next question, please?
Next is Rafi Boujakanian with CBC. Go ahead, Rafi.
Thank you. Hi, Dr. Hinshaw. We're hearing from Alberta Health and the government that the plan for families of NHL players who would come into the city along with them would be to self-isolate for 14 days before they are able to go out and enjoy the sights in Alberta as they have been shown in this promotional video. What I'm wondering is, can you tell us, are the families expected to self-isolate with the hockey players themselves? And if they are, then I guess what is the point of allowing them to come here and then go out and see Alberta and then come back with the hockey players and stay with the hockey players? Thanks.
Sure. So there's 2 different stages of quarantine that are in the plan for the NHL. The first stage is the same kind of quarantine that anyone who comes in from a country outside of Canada would need to observe, which is that 14-day quarantine to prevent spread from those individuals to others. And so whether or not the family members are going to be a part of that NHL cohort along with the players, that would be a decision that would be made by the NHL with respect to risk tolerance, essentially. And that's not, we would be requiring them to be in that 14-day isolation period, and where it happened would be part of a discussion with the NHL. What happens after that time period is the second part of a quarantine to protect the players who are involved in a tournament. And so that's the expectation, that those players are kept distant from others around them, that they're in a protective quarantine to protect themselves. And so, again, this would be something that would be more of an NHL policy. So if the family members who come with players are a part of that particular NHL cohort, then they would have to stay within that bubble. If they were to leave, then the expectation would be that they would not go back inside that particular bubble until after play was complete. So that would be, again, that framework that we've proposed, but that second part of the quarantine is a quarantine that would protect the players, not necessarily protecting the public.
Operator, can you put through the next question, please?
Next is Jeff Black with 660 News. Go ahead, Jeff.
Hi, Dr. Hinshaw. Canada is one of the few countries that recommends the 2-meter physical distancing, while like the U.S. uses 1.8 meters, Germany is 1.5, and France is just using 1 meter. The WHO says their recommendation is at least 1 meter. Are there any considerations to lower the distancing measures that we have in place here?
So that distancing measure is something that we've been discussing on our national calls. And as you point out, different countries have used different numbers, and some of those countries have shifted over time. What we know is that the farther distance of 2 meters is safer than a closer distance. And so with respect to changing it, I think it's really a matter of looking at the trade-offs from changing distancing. And although 1 meter certainly is better than less than that, 2 meters is better than 1 meter. So we're currently, again, having that discussion, and at the moment it remains 2 meters.
Operator, can you put through the next one, please?
Next is Michael King with Global News. Go ahead, Michael.
Hi, Dr. Hinshaw. One quick question and one not so quick one. You mentioned Edmonton restaurants. Any similar cases in Calgary? And then when it comes to serology testing, what best practices are you following in regards to rolling that out? Who's going to get tested? What's the province's capacity? And what's going to get done with that data?
Sure. So I am not aware of similar circumstances in Calgary, which isn't to say there haven't been, but they haven't been reported to me. So at this time, I haven't heard recently of restaurants closing in Calgary because of confirmed cases. With respect to serology, we have been working closely with the National Serology Consortium to make sure that the methods that are used in Alberta are comparable to those used in other provinces. So we are collaborating with other provinces and territories and the federal government to make sure that our methodology and our approach, again, is consistent with what others are considering doing. In terms of best practice, as the minister mentioned, serology is not a useful individual clinical test, except in some very rare select circumstances. So the approach that we're taking is really based on the purpose of serology, which is to help us understand at a population level what proportion of a population may potentially have been exposed to COVID within the past several months, and then use that information to help us understand what proportion may not have been captured with our swab testing program. So as the minister mentioned, there are 4 different studies that are looking at 2 at children and 2 at adults. And so again, best practices would be making sure that when testing is done, it's done in a representative sample of the population. And I know that there are many individuals who are very curious about their own personal results. However, if we recruited only individuals who thought they might have had COVID, we would get a non-representative sample of the population, which wouldn't be helpful for us to determine at an overall population level who may have been exposed. So that's why, again, we're doing these 4 structured surveys to give us the best possible opportunity to understand at a population level who has antibodies. And as the minister mentioned, these will be done at different time points. So the children's testing will be done every 6 months. The residual blood testing at the lab will be done monthly, approximately 10 to 15,000 samples per month in that particular group. And then the cohort of older Albertans over 45, that again is going to be repeated over time going forward so that we get that snapshot not just of current state, but looking to see how that changes into the future.
A question about numbers as well. I'm happy to answer that. I think there was also a question about the numbers as well. As Dr. Hinshaw said, there were the two studies for children that there were going to be intervals of 6 months at a time. Both of those studies have 1,000 children for each of those studies. So the first one is known as ABC3. There would be 1,000 children, 350 with confirmed COVID infections, 350 symptomatic children who test negative, and 300 healthy children without evidence of COVID-19. The other one is Child Edmonton. That again would have 1,000 children. One of the other studies is known as ATP, Alberta's Tomorrow Project, which launched in 2000 with 55,000 Albertans. So there'd be 55,000 Albertans involved in that project. And then the fourth one, the residual Sarah Project, would be taking about 10,000 samples for that one. So that's just to answer the question about numbers.
Excellent. Operator, could you patch through the next question, please?
Next is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. Just two quick questions. The first one, I'm just wondering if there's any changes to boundaries. Are we lifting boundaries between provinces in terms of advice for travel? And then the second question, we've recently seen a spike in cases in the Calgary Centre area. What has caused this increase in cases, and is it fair to blame it on, let's say, restaurants and bars reopening, as well as maybe large rallies that have been held in the last couple of weeks?
So the question about boundaries and interprovincial travel, there's been no change to our official recommendation, which is that non-essential travel outside of Alberta should be avoided at this time. Again, that's something that we continue to have conversations with our partners in other provinces about, but that's our current recommendation. With respect to the Calgary Centre cases, I haven't been notified of any cases in Calgary that have been linked to the rallies that have happened lately, and I don't have the specific detail of the sources of the cases in Calgary Centre, so that's something that we can look into and get back to you.
Looks like we've got 3 left. Operator, could you put through the next one, please?
Next is Shannon Scott with CBC. Go ahead, Shannon.
Hi, Dr. Hinshaw. I'm just wondering about the town halls that you're holding right now and the one that you held this morning. I'm wondering if you can give us an idea of what you're hearing from Albertans about the changes that they want to see to the visitor rules at care facilities, and what you're hoping will come from these town halls that you're holding.
Thank you. I appreciate the opportunity to talk about that. It's a really important opportunity to hear from Albertans on a difficult topic. So we are holding town halls with residents, family members, operators, and staff of continuing care facilities. We have 2 today, one that happened this morning and one this evening, and then there's another one tomorrow. And the critical issue on the table is the question of visitor restrictions and freedoms for those who live in these facilities. And what we're hearing is that people are really needing to know how we can move forward to allow that those who live in those facilities to have more social connection while still keeping them safe from COVID-19 exposure. And that's a difficult balance to maintain. So the purpose of having these town halls is to hear directly from those people who are most impacted by these restrictions, to hear their ideas, their suggestions for possible ways forward to balance those two things. What we have done is we've asked people to fill out a registration questionnaire when they sign up for one of these town halls, and that helps us get a bit of an understanding of their feedback and perspective on key issues about visitors and how we might move forward. It is interesting to note that of that pre-registration questionnaire, about 38% of those who responded indicated that our priority does need to be COVID-19 protection, even if some restrictions remain in place in order to allow us to protect against COVID-19. and 62% indicated that they would be comfortable with more risk of COVID if we were allowed to open up our visitor restrictions a bit more. So I think that speaks volumes about many, many Albertans who keenly want, either if they're living in these facilities or their loved ones are, more connection, more ability to visit, more ability to have that in-person communication. But it also speaks volumes to the fact that COVID isn't over, and there are many people who really need and want us to continue thinking through how do we keep people safe at the same time as making sure they have everything they need to be healthy with respect to that human connection component. So what I'm hoping to hear, what I heard this morning, was feedback and perspectives from those who have lived experience with this particular challenge. And I'm looking forward to hearing more tonight and tomorrow that will help us as we adjust that particular policy.
All right, operator, can you put in the next question, please?
Emily Mertz with Global News. Go ahead, Emily.
Hi, I'm just wondering if there's any discussion on what the timeline might be for changing or relaxing the one-site rule for workers in long-term care homes.
At this moment in time, we're not looking at a timeline for easing that particular restriction. We have looked at best practices across multiple jurisdictions for measures to keep people in continuing care facilities safe, and that particular measure is one that's come up as a key one to keep people safe. So at this time, that is a measure that we anticipate will stay in place for the foreseeable future.
All right, operator, can you put through the final question, please?
Final question is Brenna Rose with CTV News. Go ahead, Brenna.
Hi, Dr. Henshaw. I was wondering if the province is looking at relaxing the rules yet surrounding visitors at hospitals.
Alberta Health Services has actually relaxed the rules, and I wonder, Dr. Jaffe, if you'd be willing to speak to the current AHS visitor policy in acute care?
I failed to introduce him earlier. This is Dr. Mark Jaffe, Vice President and Medical Director with AHS.
Good afternoon, and thank you for the question. The full details of the visitation policies are available on the Alberta Health Services website, ahs.ca/visitation. The rules were adjusted a couple of weeks ago now and allow for, if I'm not mistaken, 2 visitors or really support individuals who are important to the hospitalized individuals so that they can assist with social support, mental, spiritual, emotional support, and are really critical in order to help with the recovery of that individual who's in hospital. Again, I would suggest that you go to the website and look for the full details. In addition to inpatients, we also have adapted the rules for outpatient facilities so that an individual coming for an outpatient clinic visit can be accompanied by a support individual as well. Thank you.
Thank you for joining us. Dr. Henshaw will provide another update on Thursday afternoon.